Okay, so we're looking at some treatment for neurological disorders in terms of a patient's gait. So what can happen sometimes with different neurological disorders is a lack of extension, lack of firing, especially the gluteus maximus muscles. So when a patient goes to extend the leg, extend the hips even, they haven't got much switching on the muscles. So all this is doing is just aiming to promote the switching on those muscles with a bit of facilitation in a traditional sort of gait pattern. You'd make sure that the patient have bare feet so they didn't slip or anything like this, and also so they can get some nice tactile sensation under their feet. You've got to be careful for things like drop foot or any other tone, for example, from a neurological condition before you see the patient. And obviously you wouldn't have a patient stood on his own normally, probably have an assistant with you, depending on the level of the patient, size of the patient, etc. So what we're going to do is, first off, I'm going to get to the side of the patient just so I've got a bit of support, and I'll probably ask an assistant to be the other side as well, or in front of the patient. I'm going to find both greater trochanters on the patient's left and right hips. And all I'm going to do is facilitate a bit of extension. So I'm just going to ask you to walk forwards, mate. I'm going to give you a bit of a hand. Just going to facilitate some extension, try and get a nice normal walking pattern. I'm going to turn around. So that was just a simple gait facilitation exercise. Sometimes with gait disorders, the parallel bars can be quite useful to allow a patient to stand up nice and straight and properly and walk with some help, but to have the support of the parallel bars just to make sure they feel safe and they can take the weight off of any limb that needs a bit of support. You'd never use the parallel bars on your own, you'd normally use with an assistant. Just for safety, depending on the patient, but normally just for safety. So what we're going to do today is, Jamie's my patient, he's had a stroke and his right leg, we've rehabbed it a bit, but we just need to give it a bit more help in terms of walking. So what I'm going to do is I'm going to get down nice and low with Jamie's feet down here, and when he takes a step forward, I'm just going to help with the natural movement that the foot should take. So heel strike, toe off, that sort of thing. Okay, so what I want you to do next, first of all take your hands forwards, that's it, and I just want you to hold on. Okay, so off, good, so I'm just facilitating, toes staying upright, the knee bending, and then heel strike, and then toes down, that's what's bring the other way through, heel off slightly so you can't hold that position, and as you're holding that position, what I want you to do is just rock backwards and forwards, just onto your back leg, and then your front leg, keeping your toes, that's it, on the floor. Good. Keep going. And as I said, I'd have an assistant probably in front of the patient. Good? Okay. Now stop. Another step forwards. So I want to take your hands further forwards a little bit. Toe off. Good. And heel strike down. And toes down. Good. And then hands forward. Good. Okay. So that's just a quick example of how we could use the parallel bars to help with some gait facilitation.